Former Chillicothe hospital employee is suing the facility for wrongful termination, which she says happened after reporting another employee's behavior.
The nurse he reported is now in legal trouble, but somewhere else. NBC4 Investigates' Isabel Cleary has been following this story. You've talked to the former employee and sources close to all of this at Adena. So tell us what you learned.
Well, registered nurse Kimberly Clark is facing felony charges in Hamilton County for allegedly taking fentanyl from her most recent employer, Mercy Hospital Anderson in Cincinnati. A former Adena employee says he reported her for the same thing while they both worked at Adena Health. He says he lost his job for speaking up.
I had gone into a patient's room and found one of the other nurses with a controlled substance fentanyl in her hands that belonged to my patient.
This lawsuit says Dustin Eng reported this to Adena Health verbally and in writing.
The following day, I talked to coworkers about what happened, and following that, there were just some retaliatory things that happened to me, and I ultimately lost my job because of it. It blindsided me. I had no idea.
A Facebook post from Clark says she resigned from where she worked.
She actually was allowed to just quit and walk away.
Eng says all he wanted was to protect his patient.
I knew that something was, was not right that was going on. I felt if I didn't stop it now, it was going to happen sooner or later again and potentially kill somebody.
Several former Adena Health employees tell NBC4 Clark left Adena and went to work for Mercy Hospital in Cincinnati, where she is facing theft of drug felony charges. Hamilton County court documents allege Clark did knowingly take fentanyl from Mercy Hospital without consent.
It puts employees in a position where they're afraid to come forward because they see something like this happen, and it often does harm to the public. Not only to the public, if it's a business, sometimes customers are hurt.
Former Adena Health employees say Clark was not reported to the police in the area. We reached out to Ross County Sheriff. They said they have, quote, no records of a Kimberly Clark associated with theft of drugs. We wanted to ask Adena if they reported Eng's claims to police and why Eng lost his job. They would not sit down for an interview or answer questions via email. Instead, Adena sent a statement saying in part, quote, Adena Health has strict policies and protocols in place that are followed when any employee issue arises, inclusive of non-retaliation for any concerns reported in good faith, including in the instance you have referenced. All protocols are in accordance with all legal and regulatory guidelines, including both Ohio's pharmacy and nursing boards. Any claims to the contrary are false. NBC4 has learned that the Ohio Nursing Board is investigating the claims about Clark.
The biggest resolution that I want from this is just to make it so that hospitals are a safe place to report these kind of actions, because inevitably it's going to happen. Any place, no place is safe from this kind of behavior. I just want to make it so that it's a safer place for this, for people that witness these type of things, for them to come forward.
We reached out to Clark's lawyer and Mercy Health for a comment, but have not heard back. Clark has a court date in Cincinnati on March 6th.